such a great pleasure to be here, to have a small contribution in low-carb community that we can together make a more sustainable healthcare. So at first, my presentation was yesterday. When I looked at it a few weeks ago, then I said, oh my God, that's perfect. I'm very lucky. I just do it and sitting relaxed, listening to others. A few days later, I checked it and it was Saturday, Friday afternoon. Anyways, I wasn't lucky. So, as you know, my name is Nasim. I'm the professor of healthcare innovation. And the way that I look at a low-carb lifestyle, I look at it from two different perspectives. So I don't have a clinical background. The first background is healthcare innovation. And what is that? Healthcare innovation, basically, it means that how we can be innovative and consider some sort of like novel approaches in our healthcare system to be more efficient, effective, and sustainable, which I think all of us, we are trying to do such a thing. The other perspective of my work is preventive healthcare and health promotion. As you see, we have at least 11 key factors in terms of lifestyle behaviors. And you may see me more in community and also in nature rather than being in my office in front of computer and doing publication. Of course, I don't underestimate publication. We need to advance our knowledge and be updated. But at the same time, it's really important for me to preach and advocate for healthy lifestyle behaviors and prevention, what I really believe in it in terms of sustainable approach to healthcare. One of the key challenges that I have in general as an advocate and professor of healthcare promotion is that, unfortunately, if you help millions of people to have healthy lifestyle behaviors, it may go unnoticed and you may don't have enough support. But for example, if you cure a disease or something like that, it will be in medias and everything. So it's a bit challenging because it's not really tangible. So today I'm going to talk about three of our papers. One of the key papers is a combination of fasting and low carbohydrate diet. Before starting, can I ask you that how many of you are actually practicing low carb lifestyle on a regular basis? Almost everybody, 100%. What about fasting on a regular basis, not just 1 or 2 times? Perfect. Can I ask how many of you are doing fasting plus low carb lifestyle on a regular basis? Okay, I have some great news for you. So apparently the number of low carb and fasting together, it decreased. So there have been a lot of studies separately on low carb lifestyle and thousands of studies on fasting as well. However, combining these two together, we haven't had enough studies. Only 15 papers we could find to include in our scoping review. And the reason that we call it a scoping review is actually that there haven't been enough studies that we, for example, be able to do a meta-analysis or something like that. So a scoping review meaning that we want to understand the landscape, the scope around the topic. So the studies we included, although we follow the systematic review approach, the process, the studies we included, they are actually more heterogeneous rather than homogeneous. So we are doing some sort of thematic analysis to understand the landscape and the scope. So besides this paper, we have some collaboration on some other research around the school lunchbox decision making, which is a big challenge for parents, that how with their children they make a decision making about healthy eating in terms of their lunch boxes. The other thing is ecological framework to curb the trend of ultra-processed food, that I'm going to talk about this as well, because I believe the first thing that we need to do as healthcare professionals or healthcare managers and leaders is to help others and empower them to understand the issues and philosophies around ultra-processed food and what it's doing with their body. And after that, we need to move on to more sustainable approaches to eating patterns. So food industries and factories, they have created a lot of colorful foods for us, but they have added a lot of additives and preservatives, and they are quite addictive. On the other hand, our Mother Nature created a lot of colorful food for us as well. By the way, I'm very passionate to cook, so all the food that you see, it's like my own cooking. So, thank you. So, one of the things that I always say when I eat, I say it should be healthy, tasty, and look good. Otherwise, I wouldn't eat it. So basically, whenever people, they ask me that as a person with expertise in health promotion, what do you think, what kind of food we need to eat? I give them 5 criteria. I would say that eat fresh from Mother Nature, fresh food that is coming from Mother Nature. If your great-grandma didn't eat, neither should you. Nutrient-dense food that they don't need any supplements. Choose foods without boxes. If they are in boxes, try to find simple, easy to read labels. And to be honest, when we put all of them together, they meet the criteria of low carb lifestyle. And I call low carb as a lifestyle, not diet, because diet is short term and not sustainable. So when we look at past smoking, it wasn't banned. Even healthcare professionals, they were smoking in hospitals and healthcare settings. But when, for example, this photo is a very ordinary photo on beach, and when you look at everybody, they look very fit, as if it is a fashion magazine. So basically, it seems that we actually swap one health crisis for another. So we were able, after 20, 30 years, to ban smoking, especially indoor smoking, but then we replaced those smoking with ultra-processed food. And the issue with ultra-processed food is that it is outside of our control. Unfortunately, we lose our control. And I think all of you have seen this video, so I wouldn't play this. That's a baby who had ice cream the first time in his life. And he was so excited that he couldn't resist that. He was losing his control. And it's totally normal, because ultra-processed food actually is changing our biology. It's impacting dopamine, which is the feel-good pleasure, and at the same time serotonin, which is the happiness molecule. So it is not a willpower thing that we blame people. The process is exactly like smoking and drinking, that we will get addicted to that, and we need years and years in order to ban that and decrease it, maybe up to 30 years like smoking. And the problem is that, ironically, sometimes we eat the healthy food ourselves, but we give the junk food to our children. And if we look at the menus of restaurants, it's just crazy for children. It's really interesting. We do a lot of gatherings, and always I put everything healthy together. Once I was passing, and one of the guests was saying that at their place, you never can find chips or anything like that. This is not good. My child is crying. And she was telling the husband to go and buy some junk food. And then suddenly I was hearing this, and I was saying, I will consider this as a compliment. But the wife sent the husband to do some shopping, and they bought a lot of junk food for everybody, all the children, which was so sad. So these kinds of things, they are real stories that are happening around us. And you know what? In hospitals, these are the menus of hospitals. Of course, some of them, they are real food, like banana and they have vegetable broth, but you see a lot of ultra-processed food. Hopefully, in future, we can have some signs such as ultra-processed foods not welcome in our healthcare settings, because true wellness and patient care come first. Or maybe in restaurants, we can see ultra-processed foods are off the menu because your health matters. Hopefully, in future, we can see these signs like smoking and drinking also. So as you know, there is a big rise in terms of chronic disease based on the recent statistics from WHO 2023. 74% of the death globally is coming from chronic diseases. Particularly diabetes is the major driver, and diabetes is actually the mother of so many multiple long-term conditions, which we hear a lot that, and we see a lot of evidence that it can be reversed by low-carb lifestyle. And overall, unhealthy lifestyle behavior, such as eating pattern, is one of the main drivers of chronic diseases. And of course, all these unhealthy lifestyle behaviors that result in various chronic diseases, it will impact the sustainability of our healthcare system. When I'm talking about sustainability, it's not just financial sustainability, because most of the time we just think about financial outcome, but it's about social aspect of the health, social sustainability, all the burden on individuals, their families, society, community, all the pain and suffering that we go through, and also the impact are on environment, which is crazy when we look at the statistics that what our healthcare system is doing with the environment is very, very sad. So if we can only decrease the percentage of chronic diseases by a few percentage, we can save millions of dollars. That it could be, you can convert those dollars into the social aspect of sustainability, environmental aspect, and also financial aspect. So unfortunately, we created all these ultra-processed food, pouring ultra-processed foods on people, and then as a solution, drugs being poured on people as a solution. So too many people take too many pills. But at first, ultra-processed food was developed because they wanted us to have safe, accessible, and affordable food. So if we want to think about the intention, maybe the intention at first it was good, but then slowly dietary guidelines, they were encouraging carb-rich foods, that we got into the trap of highly processed food again. And if you look at different countries, between 27 to 71% ultra-processed food worldwide is consumed per day in terms of the calorie consumption that we have. USA has the highest, 71%, and Australia is 42%. So as you know, there is a combination of fats, salt, and sugar, which is the bliss point based on the Howard Moskowitz, that this bliss point is very, very addictive. As I said, it's not a willpower thing, and we shouldn't blame people. We need to do something about it. So and then only 10% increase in ultra-processed food will result in a 15% rise in mortality risk and waist size. The sad part is that those advertisement companies, they target our children. And according to some of the recent studies in USA, Australia, and New Zealand, they actually, the advertisement, social media or advertisement in schools, they do advertisement by purpose in social media for children and young people, and at the same time around the school or trains, the places that children and young people, they can see it. So that's a big trap. So based on the recent studies, also, if we can only replace highly processed food with real food, there will be a big, significant improvement in terms of weight loss and health. Even we don't need to talk about low carb, which is great, but I mean, even replacing with real food, it will make a significant difference. All this evidence, it's very alarming, but there is not yet any practical solution for this. So in our paper, which is an ecological framework that how we can curb the trend of ultra-processed food, we suggest that curbing the trend of ultra-processed food is everyone's job. So basically, we need to work together in order to curb this trend. If you look at this ecological framework, it's starting from individuals, from our schools, communities, families, and government. So basically, sometimes I think that in terms of individuals, they have such a great power, but we shouldn't underestimate our power. So considering that bottom-up grassroots approach, we people, we can get together, united in order to change bad practices and bad policies. But of course, we need top-down approaches as well from government to remove subsidies, to have taxation on those kinds of ultra-processed food, to restrict marketing around ultra-processed food, public awareness campaigns, labeling and transparency, school nutrition policies, financial incentives for healthy eating, parents empowering approaches. All those things really matter, and our government can help with that, and also at the community level we need to do much more. So considering a top-down approach plus a bottom-up approach together, it will help us to curb the trend. But the good thing is that based on the longitudinal cohort studies across 32 years, it has been shown that obesity, smoking, drinking, depression, they all are contagious. So we can say that healthy eating patterns such as low carb and fasting lifestyle, they could be also contagious. If you have networks that they are health conscious people, they are social conscious, and at the same time they have high level of willpower. So we need to be more connected to those people, and we can be one of those to bring other people together to make that grassroots bottom-up change. And I'm using this gun analogy as well. So every one of us carry a gun with ourselves. But then it's important to know that do we pull the trigger on illness for ourselves and those around us? So basically the bullet is all those risky genes that every single one of us has. And then the trigger is the lifestyle behaviors that we consider in order to prevent that trigger, that pulling that trigger. So I think our health is in our hand if we have the right information and if we know how to turn off those bad genes. And overall, I think if we can consider some sort of empowering approaches to individuals, we can fix it before it's broken. We can be more proactive, functional, sustainable, to consider long-term approaches such as healthy eating patterns, including low carb and fasting. We can empower individuals to actually take their health and well-being under their control, because sometimes at some point they may think powerless, and they may think they need to be dependent on the pharmaceutical companies and healthcare system forever. So we need to empower them. We need to help them to bring back their power and control. Also, at the end, of course, I don't want to underestimate what our healthcare system is doing for us. Of course, if something acute is happening for us, we need to go to doctor, we need to go to hospital to fix it. But having a balanced approach in terms of medical support and individual empowerment is very important to achieve that sustainable healthcare. Okay, let's talk about fasting and feasting a bit. So this food that you see, I'm originally from Shiraz, so you need to find where Shiraz is. And this food, we prepared them in Shiraz with charcoal. They are so tasty. If you come to the Gold Coast, I'm happy to host you. So basically, we have feasting, periods of feasting and fasting. And now I want to talk about this paper which combined fasting and low carb together, which we could find a total number of 15 papers. So basically, in terms of fasting, of course, we have this hierarchy that it could start from real food, then low carb, ketogenic, ketovore, and carnivore. Of course, carnivore is the ultimate, which could be quite challenging and restrictive. So it depends on our context, situation, lifestyle behaviors, history of diseases, that which approach we need to consider. And in terms of fasting, of course, there could be so many different types of fasting: intermittent fasting, time-restricted fasting, 24-hour fasting, alternate day fasting, 5-2 fasting, mimicking, all those things that we need to consider the context, that how we want to combine different types of fasting with different types of low-carb diet or lifestyle. But before moving on to the result of this scoping review, I would like to talk about fasting itself and how challenging it could be. So when I go back during the time that I was teenager, like 12, 13 years, I started doing religious fasting, and I found it very, very challenging. I couldn't do it, and I broke my fast a few times, and I was crying because I was thinking I committed such a big sin, and the feeling was so overwhelming and bad. And again, when I started health-driven fasting, exactly the same thing happened. I couldn't continue, I couldn't tolerate it, and I broke my fast. Again, I had those feelings that why I'm not able to do it. I'm just mentioning this because I think fasting is not really easy. We shouldn't expect our patients or individuals to do it in the very first place. So maybe it needs to happen gradually and slowly, and starting even with low carb diet and slowly moving on towards fasting as well. Okay, based on the finding of our scoping review, the combination of fasting and low carb, it helped with prevention, diagnosis, and treatment. In terms of prevention, it helped with preventing chronic diseases, maintaining and achieving a healthy weight, and also sleep quality. It helped with cognitive function, stabilizing mood, and all those things in terms of prevention. In terms of treatment, we categorize the themes across adults and children. In terms of adults, for treatment, it helped with type 2 diabetes, it helped with prediabetes, cardiovascular disease, inflammation, and in children, the focus was more around epilepsy. However, I need to highlight that in 5 papers that we included around children, they highly recommended not using fasting in children, only using low carb, because low carb is more feasible and they tolerated more. So basically, they used a bit of fasting, but they stopped it and they just focused on low carb, and they could get the results they wanted. Okay, how fasting and low carb, they work together to provide a synergy. So fasting triggers fat burning, low carb sustains fat burning. Fasting induces ketosis, while low carb maintain ketosis. Fasting promote autophagy and also regenerate of cells, while low carb allows longer period of autophagy and it supports cellular regeneration. Fasting helps with lowering blood pressure, while low carb helps with increasing HDL and decreasing triglyceride. So basically, the dynamic duo will be like that. Fasting cleans, low carb sustains, fasting repairs, low carb maintains, and fasting resets, low carb supports. So when we put those two together, the synergy could be much more. Okay, the mechanisms, if I want to talk about it, I use this analogy of happy house and sad house. So basically, when we look at the happy house, consider yourself as a host in that house, that when you have healthy blood sugar and healthy food, it's like this, that you are having nice, good friends, that you have a lot of commonalities, and those friends, they are helping you to stay healthy, happy, and peaceful. On the other hand, when we are using a lot of ultra-processed food, it will result in insulin resistance and elevation of blood sugar, blood glucose, and we can consider that as friends, that they're coming to our house and we don't have that much commonality with them, and they are impacting our health, happiness, and peace negatively. I also use the analogy of fridge. So these two fridges, of course, I provided the links below. They are real photos. And, it made me questioning that, oh my God, how come such a thing could happen, especially the other one with a lot of dishes in the fridge. So consider our body as a fridge. So if you look at these two fridges, there are no spaces to breathe. And, of course, like fat outside and fat inside. So at some point, we may decide to clean up the fridge, get rid of all those ultra-processed food that we bought. And of course, sometimes we buy healthy food, healthy ingredients, but because we don't have enough time to do preparation, they will stay in the fridge and they will be spoiled. So basically, at some point, we decide to first clean that fridge, which could be like fasting, and then replacing those ultra-processed food and spoiled food with nutrient-dense food, such as meat, fresh coming from our mother nature. I don't mean ultra-processed meat, plus vegetables. And this is our fridge, but those bananas that you see and oranges, we put in yogurt in order to slow down the blood sugar, so we don't eat it just like that. Anyway, so if you can use the analogy of the fridge, when we clean up the fridge and put the nutrient-dense food there, it will help with the autophagy, which is the cleaning up and self-eating, and then regeneration and repairment will happen, which is DNA repairment and replacing the damaged cells with more functional ones. And of course, it will help with stem cell activation, and even in those people with cancer, actually both low carb and particularly fasting could help a lot, because it will give them more tolerance and resistance in terms of tolerating the treatment and chemo. Okay, now a question for you. If you want to prioritize fasting or low carb, which one do you think could be prioritized or superior? Those who are saying fasting, can you raise your hand? What about low carb? Very interesting. So there is some sort of uncertain synergy, but there are some indications that low carb can be superior because of different reasons. First, creating ketone bodies and less craving, which is helping to prepare our body. And secondly, when we go low carb, and especially if you are getting like carnivore, automatically it will help with some sort of fasting, automatic fasting, because we're not able to eat that much. The main reason when we eat, for example, ultra-processed food is that because they are addictive. If we eat the right food, it doesn't matter, in my point of view, how much we eat. We can eat as much as we want because we're not able to eat too much. So it will make us fuller for longer time. Okay, in terms of recommendations and indications on combination of fasting and low carb, in terms of practice and policy, there is no one-size-fits-all approach. And this is very important that we pay attention to the context of each patient and individuals, their stories, their life, their cultural background, social background, socioeconomic background, all those things. And for example, we cannot compare a chronically ill patient with a healthy young athlete. So we need to consider the context to have not having one size fits all approach. And secondly, listening to our body. We shouldn't force ourselves to do fasting always. So it's really important. For example, when I was doing religious-based fasting or health-related fasting, I think I didn't listen to my body, and I was like 12 years old. Maybe at that time it wasn't right timing for me to do it. And anyways, religious fasting also, you're not able to have water as well, because the philosophy behind it is that you have sympathy for those people that they don't have enough food and water. So that's the philosophy behind it, which is a spiritual thing. So understanding the philosophy behind different kinds of fasting is also very, very important, that we enhance the awareness for individuals that why fasting will help with their life, health, and well-being. So healthy versus unhealthy low carb, as you see in terms of advertisement and marketing, they always find ways to ruin the most healthy eating patterns as well. And as you see, there are so many low-carb foods and that they've been ruined by the marketing and food industries. So that's really important to distinguish those. And I always say, if it's in a box, we shouldn't eat it. So if it's coming fresh from Mother Nature, we need to use it. In terms of the population that they shouldn't follow fasting, basically, it could be children, pregnant, breastfeeding women, people with anorexia, those with adrenal dysfunction, kidney complications, and renal dysfunction. Also, in terms of practice and policy, there is a big gap in terms of the guideline, in terms of the evidence, and also what we are doing in terms of policies and practices. And that's really important to understand how we can bridge those gaps and changing the bad policies and practices that we have in the healthcare system. In terms of future studies, this scoping review that we've done, there have been a lot of inconsistent definitions around low carbohydrate diet and fasting overall, which could make it a bit challenging to analyze those data. The scoping review, we did some sort of thematic analysis, but for systematic reviews, it could make it quite challenging to put that data together. So defining low carb and bringing all those homogeneous papers together is really important. And also high quality studies, especially in terms of combining fasting and low carbohydrate diet. We could only include 15 papers that those papers, some of them, they were like low quality papers as well. So it's really important to include more controlled trial studies and high quality, like random sampling and all those things. There could be great potential in terms of combination of fasting and low carb for neurodegenerative diseases and also Alzheimer's and Parkinson's. Now let's do a bit of fact and myth checking. So if you can help me with this. So when I read it, if you can say it's a fact or myth. Fasting enhances metabolism and energy. Great. Fasting isn't stressful. Myth, because fasting stresses the body. Healthy adrenal function is essential to handle it. Fasting causes muscle loss and lowers growth hormone. Yes. Calories alone drive weight loss, and fasting is only for weight loss. Low-carb diets doesn't increase heart disease. True, and there have been a study that I put the reference here as well. They did the longitudinal studies regarding low carb for 10 years across 10 patients, and at the end that they had this conclusion that low carb lifestyle doesn't result in heart diseases and cardiovascular illnesses. The next one, LDL and HDL cholesterol increase are always harmful. Yes. And at the end, fasting makes us richer, fitter, and more good-looking. That's very true. And I think the more good-looking we want to be, maybe we need to go carnivore. Just my assumption. Okay. Thank you so much. I really appreciate your time.